Great. So, Father Carnes, could you kick us off and with your extensive experience in the field, give us a view from the ground. What is the context of need in the developing countries, and how has that changed over the last several years?
You know, I wanted to speak to three ways I think things have changed in terms of both development and the aid that's needed in response to disasters. So first of all, I want to point out that the challenges and in fact the disasters themselves have changed. Second, I'm going to point out that our appreciation of the social and political and economic dimensions of the need has changed. And finally, our understanding of ourselves as caregivers and care providers has changed. So first of all, that first idea, disasters have changed. You know, if we go back just a few decades, really into the 1960s and 1970s, when we saw disasters, often these were affecting more rural populations in simpler housing that was less likely to cause the kind of loss of life that we see today. So we look at Port-au-Prince with so much substandard housing built in densely urban areas, and the loss of life is just tremendous right in the moment. Because of that urbanization, you have so many people then dependent on infrastructure to get their food, to get their basic water, their basic supplies. It's not like they can go out to the countryside and sort of just rely on family or friends or their own agricultural production. So the need is greater. When you cut off the infrastructure, even if it's poor infrastructure that was provided before, the immediate need is tremendous. That's something that's very different today than we saw decades ago. In fact, many of the analysts that study aid look at an inflection point in the early 1970s and say prior to that, disasters just functioned so very, very differently. Also, what's changed is the disasters highlight for us the very sense of dependence or sense of marginality of those who are most affected. So in my experience working in Honduras, the people that we had the hardest time working with and spent our most effort on were those people that had been driven to the margins by poverty and inequality for a very long time. In Honduras, this was the people that lived on the levees, those that lived right at the edges of rivers that were flooded in the hurricanes. And these were people that had never lived in communities. So one of the challenges was bringing them into a more unified community, giving them a sense of belonging and giving them a sense of having a constructive future. So I think the kinds of disasters, the kinds of needs have changed. Second, I think we understand better now the social and political and economic dimensions of our responses. We understand better that aid can be misused, can be misappropriated. We know that predatory states, which often like to make the most of aid for their own uses, we've seen a number of dictators that will try to direct aid to their cronies or will tend to use it for their own purposes. So we've found that we have to be a lot smarter about the kinds of aid that we provide. The literature has really developed a great deal of models of how do we understand this sort of predatory use of aid. Second, as I pointed out, we understand now that inequality affects the way that we go about our responses. And it means that we can't rely on a simple top-down response to kind of parachute in and bring in our own responses, but that we really need to be attentive to the kinds of political and economic dimensions that exist on the ground. It requires a kind of listening to local needs, an attentiveness to local leadership, a sense of how can we build on existing political and social institutions that exist. This is something I think we were a little bit naive about when you go back just a few decades, but it's something we've been understanding much better now. And finally, we have new opportunities provided by the new kinds of communication that are around, and we'll be talking about this more with the other panelists. But in my experience in Honduras, when I arrived, one of the reasons that Jesuits were put at the forefront of delivering aid in northern Honduras was that we ran the radio station. And the radio station was the main way of communicating with folks out in the furthest countryside, to be able to tell them food aid will be delivered on this date, someone will come through to do a census on this date. Cell phones weren't around yet. Now you look at the responses in Haiti, and we were talking about this a little bit in the green room earlier. Cell phones, PDAs, BlackBerries now are ways that you can get all sorts of information that simply didn't exist before. So there's much better networking that can go on. And finally, and most importantly, I think what we've learned, at least as a church organization going about aid, is the importance of understanding our own core competency and where that's limited. We often end up as the church as a first responder because we're already on the ground, so people turn to us when their house falls down or when there's a disaster. They go to the church and ask the priest if he can help. And in some ways we can be an important network of responding, but we realize more and more that's not our core competency. The Jesuit Refugee Service, with which I've worked some and which is present in a number of these areas, really sees itself as a long-term provider of accompaniment, of education, of advocacy, but these are the kinds of things that you really can introduce after the initial disaster has happened. They're really hard to bring in those initial first moments. So we've been forced in sometimes. In Haiti, we have a number of Jesuits who are already there on the ground in the Jesuit Refugee Service, who are trying to build and partner with other organizations. But where we can, we try to direct people to the other aid providers. We try to be more of a hub or provide some sort of network of services. This requires a certain amount of humility. I think, and that's something all of our organizations can probably speak to, is the way that we start to find out that we can better provide aid when we work together as a group, when we can listen to one another, when we can coordinate. In Honduras, our group of Jesuits worked very extensively with the World Food Program and with the the International Office of Migrants from the United Nations. So this sort of coordination becomes crucial because each of us has core competencies that we can best play to. You know, when I talked to Jesuits working in Haiti, they said one of their priorities right now, and they're working in 7 different camps, 3 of them coordinating them, 4 others where they're providing accompaniment, but they said one of their key emphases right now is already thinking about an exit strategy, already thinking about how can we be making sure that we're not the long-term providers of aid. We'll provide accompaniment, advocacy, education, those sorts of things, but that won't be our long-term goal. I think this is a real change in mindset, where before we might have thought that we would be there for the long haul. Now it's much more about how can we come in, promote productive change, work with others, and then play to our own strengths.
If only the Jesuits could run Iraq and Afghanistan.